Dr. Menon told you about the hardcore robotic surgery. I'll tell you about Vattikuti Foundation and who we are and what we want to do in India. Vattikuti Foundation, as you know, is a charitable organization founded by Raj and his wife Padma Vattikuti, and they had enormous luck with the business. They had a company by the name of Covances, which made a lot of money, and they decided to give it back to the society. And that's where Dr. Menon's program came into existence, which was almost 10 years ago. And then Raj got busy with his other businesses, buying companies and selling companies. And Dr. Menon's accolades and growth was really enormous and stunning, which excited him again. And I came in his contact through Dr. Menon in sometime in January 2010. And he was very keen to replicate that experience and propagate it further. We took no time to decide that our first ground should be India. Besides the region that myself, Raj, and Mani's roots are in India, that's of course one of the regions, but there were much more stronger reasons for us to choose India. And one of them was tremendous surgical skills of the Indian surgeons. First institute, as I told you, was established in partnership with Medanta, and courtesy Dr. Menon, we did a business plan from Ross School of Business to study this phobia of cost. How can we make it to happen in India? Because still then, the impression or the history of robotics was very bad in India, as I told you. And even before Medanta came, we had the report. And they made their structure and everything as per the report, and they bought the SI system, and we have a multidisciplinary program there with 20 surgeons from different disciplines. They work for robotic surgery, and otherwise they do their work. We are hoping, as the question was asked by Dinesh Kuni, we are hoping that many of them, as a natural process, would confine to robotic surgery, as it has happened in Dr. Menon's institute. There were lots of excitement and questions on the Veena Cable Congress, which any urologist knows that it used to be a nightmare to find cardiac surgery and arranging for the blood for the residents and all. But let me tell you this, Dr. Menon did after his 5,000 patients. So it cannot be taken, and still I know Montorsi's comments, and it's taken as that whether it should be done or not. So I don't think it's something which we can debate for and against. It is the surgeon who feels that now he can do it. But nobody would believe that this patient, without one blood transfusion, is able to walk out like a sebaceous cyst adenoma. So the rewards are enormous, but when to do, which patient, you will decide depending on your experience. The model Vattikuti Foundation has evolved is a multidisciplinary program in network touching volumes, high capacity utilization. And what we are telling that even if you take cardiac surgery, which is a very hard taskmaster for the robot, because there are two procedures with caps and your mitral valve reconstruction. The clinical algorithm is very complex. On an average, 3 surgeries minimum can be done on a robot. And if you use such a high capital investment equipment, we say that you use it for 300 days. So you're talking of 900 surgeries before you go over to the other robot. That is the capacity. Even if you are at 80% of the capacity, 600 cases you do. Whereas the break-even is about 252 cases you need to do. As I view at the foundation and robotic surgery or minimally, at one end is a maximally invasive surgery we started with. We are on a path, and there is no debate about open surgery and minimally invasive surgery. And somewhere near the state-of-art surgery is the Da Vinci robot. But it's not the end, it is still a process. And foundation is committed to help people walk, surgeons walk on that process, to make surgery redundant completely, what we call no surgery. It is not going to happen in our lifetime. So we would embrace any technology of future and act as a conduit where the cost is a deterrent to bring it to the common man. Now when I say common man, it doesn't mean that it would be available, because most of the press hounded me that how would you make it available to a villager or something. All I say is the relativity. If the surgery costs in United States anywhere between $50,000 to $75,000, and 50 people from a country over 1 billion is able to take advantage of it. If you make it available at $5,000 to $6,000, it's a great achievement. I consider that really we are moving in the direction we should be. And with the volumes, the foundation has a multi-pronged approach. At one end, we are trying to capacity utilize the infrastructure by multi-specialty large volume of cases. At other end, we are working on with the intuitive to impress that India is a market they have ignored for a very long time, and we are requesting them for multiple more uses of instruments or differential pricing as happens in most of the other endoscopic equipment, or even if the volumes go high, they should seriously consider manufacturing these instruments here. Our advantage at Vattikuti Foundation is that as much we have strong partners in science, business we know how to do it. So far we know how to do business and make money, but now we have added in the foundation how to use money for spreading or making a difference in the quality of human life. We have redefined the charity. Charity initially was a blind charity that you give and forget, but here it is a sustainable model of charity because we want to grow. So at one end we do business with the social entrepreneurship motive in Vattikuti technology, but Raj is very clear that accrual of technology's profits would flow to foundation. So I happen to be the spending arm of the foundation. Mr. Subramaniam has to get money, like my father, and keep feeding me with that. So why I say that these are the confusions in the mind. As regards to the questions we had about the training and all, you cannot have them in one format. And I have found it is the commitment of the surgeon that really if you feel that there is a technology of future, and why shouldn't you? For the simple reason, as I say, the surgeon always wanted to see the target area well so that they could do well. If it gives you a magnified three-dimensional real-time image, why should you object to it? So it gives you a hint that the future of the surgery would be an assisted surgery. Human capabilities will have to be augmented by a technical or mechanical interference or whatever you may call computer assisted. Second thing what it does, it makes you to do your job precise. Dr. Menon and his team were doing a retrocable unit through a transmesocolic window at Hyderabad. And then you realize how much unnecessary tissue meddling you do. And that all translates into quick recovery. So the future of surgery, this is the way the surgery would go. Days of open surgery are numbered, not that it can always be. In this country, everything would go on, but the direction is very clearly known. It's no more at the experimental stage. I have made a point that it's one of the biggest things is to really create a task force of robotics where the urologist, because if you try and see, you do transurethral resection, which is no different than transoral surgery for an ENT guy. So I think we have spent 50 years or so dividing medicine into rat holes. Probably it is time to demolish these walls and see patient on the whole. Besides that, foundation has very high academic ambitions. And foundation, besides developing high volume, high quality surgery from these centers, would like to facilitate an academic background. We have a plan for your database. And once we have a network, immediately you become partner to our network institution. And we would like to maintain this database. And that database would be yours. Nobody could steal this data. We de-identify the data or make it sterile. Then we take this data and merge from all the centers which will be uniformly maintained and provide you a consolidated data back to you for benchmarking to make sure that how it would pave way for multicentric studies, prospective and retrospective. And there is no compulsion. You like to work with somebody at Alls, Belgium at one of our centers, we would be very happy to coordinate that. You want to develop a patent, because of our presence in different geographical regions, we can leverage strength of one place, like where it would be quickest to do the animal work, where do you develop the prototypes, and how do you do. And once you have IPR or a patent, then it's very tall order for doctors to make money on that patent. And that's why Ross School of Business, Ross University, University of Michigan, realized that they have large number of patents, but they are not making money out of it. So now they have asked Ross Business School to put the interns with the scientists to see how can you really cash on that technology, whether it should be licensing the technology, whether you outright sell the technology, or yourself go as an entrepreneur. Foundation intends to help the innovations from these centers to do. Foundation is also having a website which we are investing heavily, and it is, the structure is based in Bangalore, in Foundation office. And we desire to make it one-stop educational portal for robotic surgery. And that also gets the material from these centers. So all your videos, whatever is assistance needed, we would be very happy to provide. We would like you to actively contribute to this. And not that by compulsion, but once you have consumed your video in your society presentation or a competition, then usually these discs lie in your offices. You can always put them on the portal which people would be benefited by a big video library.